Our pets are a constant presence in our lives. They're our best friends and always happy to see us, whether we've had a good day or bad. And that's why it can be so hard to lose them, whether you're 5 years old or 50. And here with another of his pet prescriptions, this time to help us prepare for and grieve the death of a pet, is veterinarian Marty Becker, author of The Ultimate Dog and Cat Lover's Guides. And of course, Dr. Becker, it's so great to see you here. Of course, we're also joined by these two lovely little animals. This is Rosalita and Pally, both available for adoption from the Humane Society.
Unbelievably, there's 6 million dogs and cats euthanized every year in shelters. So, you know, whether it's Pally or Rosalita, there's lots of pets that want to move from the cage at the shelter to the couch at somebody's home.
And they are so, so sweet. That's why, it can be so hard when someone has to deal with the loss of a pet, or even worse, with having to make the decision whether or not to put a pet down if they're suffering.
In your lifetime, you're going to probably deal with the loss of 2 or 3 pets just because of the lifespan of a dog and cat. And so one of the most difficult things as a veterinarian is knowing, you know, when is it time to euthanize a pet. And I do have one rule that I set in stone. And when I talk to clients over a 30-year career, I'd rather be 1 month too early than 1 hour too late. And I think it's really a gift that we're able to give an animal that is suffering, that has an incurable illness, that we have that gift. But if you need to, be a little early, but never be too late.
And to put some people's minds at ease, tell us a little bit about euthanization, which is the most humane way, obviously, of putting your pet down.
When I help people, there's no one decision that, you know, okay, when they get to this stage or these blood tests, it's an individual decision on when to put your pet to sleep. Some of the things that's going to help you decide before we actually euthanize them is what's the quality of life? Mm-hmm. You know, is the animal still able to eat and drink and go to the bathroom? Can it groom itself? Does it still have some of the same happy activities? You know, what made the dog the happiest? Was it chasing a tennis ball? Was it going for walks? You know, did the cat just like to chase a laser pointer or just be able to groom themselves? When you finally come to the decision, you know, that it's time because, you know, the cat or dog is in pain, it's an incurable illness, it's overly expensive, because sometimes people think, you know, should I spend $10,000 when I only have a 5% chance of this working? Every hospital does it a little bit differently, but it's a very painless procedure. Typically we put in a catheter so you don't even have to hit a vein. The catheter's already been placed. There's a solution administered, and it kind of does 2 or 3 things at once. It anesthetizes them. It stops the heart, stops the brain activity. There may be one little final gasp or something like that, but it's almost like that. Mm-hmm. There's a few things to know, that sometimes their eyes remain open. That's normal. One little last gasp, but very painless, very easy to do. And
you also recommend that people look into pet health care insurance as perhaps one way. We discussed the cost of pet health care can be very expensive sometimes. We have a term in veterinary medicine called economic euthanasia. When they first come in, they'll say, do everything, doctor, and then it'll reach a certain point and they'll come in and say, we talked about it overnight, we don't want them to suffer anymore. Really what they're saying is we can't afford it. With pet insurance, it raises that level up. Instead of being $500 or $600, it might be $5,000 to $10,000. So I have veterinary pet insurance for my own pets, even though I'm a practicing veterinarian. We all know medicine has gotten very expensive. It's complicated, it's sophisticated. There's great things we're able to do. So I definitely recommend that. All right, and then once, if the decision has been made to put your pet down, how do you recommend telling your children about it? Because children are so attached to their pets. Here's what people do. I've written a lot of books, so I've saw a lot of letters from people, and people would say the dog ran off, or it left and didn't come back, or the cat left, we don't know what happened to it, or they went to sleep. Don't use those kind of terms, because what if Dad is off on a business trip? Does that mean he doesn't come back? Or if I go to sleep, does that mean we don't wake up? So you find age-appropriate ways, but you speak honestly about them. And actually, I think it's really good that they learn about a thing that they love. The family loves that has passed, and they learn about a grief, because you're going to grieve. This is a family member. When I was a kid growing up on a family farm, animals had a utilitarian role. You know, well, now they're 4-legged family members, and so you're going to help them go through all the stages of grief just like you would for a human family member. And for some children, it can be their first experience with death. Yes. And now what about other pets in your household? Because those pets can be attached as well. I learned this when I first learned about this. It was one of those things that I had my eyes open, and you didn't realize that these pets are so close to each other, you know, and both dogs and cats. It can be even mixed species.
I actually, when we, at North Idaho Animal Hospital where I work, we actually encourage people to bring the other pets in when we euthanize a pet. Because if they're there present when that pet passes, they have a sense that they're gone. And otherwise, if you're done it without their presence, if you can't do that, we actually tell them to take it home and so they can actually see the body, because they can't figure out what happened. And so they'll be looking around the house, they'll be pining for them, they'll be depressed. But if they're part of that process, they recover. They have an understanding of that is different.
They have a greater understanding than sometimes we give them credit for.
Yeah, before, no, it was one thing to have the human family understand, but often we've not worried about the pet family. But it's quite remarkable and touching the way that works.
Sure, and you said that it also can help to have a memorial service.
Yes, and that can take several things. Like, you know, as a veterinarian, I've helped literally thousands of pets pass over the year, and I've cried with lots of people. But I've been there myself when our own pet passed recently from cancer. I was crying so hard that I couldn't see. I went to wipe my eyes and knocked my glasses off and about ran off the road. And you know, I understand. I mean, I was going through all the same stages. When we came home, though, we got the dog's favorite blanket. We had a favorite toy, some favorite treats, and so when we actually buried the dog, we had a little ceremony. We all said our words and things. And if you live in the city, if you cremate them or you just want to have a figurine that's of the same breed, but some kind of service where you have a thing to say goodbye and say what this pet meant to you. And
it just helps to have that moment in passing.
It does.
All right. Well, Dr. Becker, thank you so much. And for more information on the grieving process or to find out how to take home either Rosalita or Pally, you can visit the health page at abcnews.com.